Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes. Our contact number is 76967 34256. You may call us for the best OET coaching and for any query related to OET. And we assure you for the best OET sample videos as well. Please subscribe this channel and share with your friends. And please listen to all the videos till the end to reap the maximum benefits. So when it comes to OET, obviously I was just talking about this small task. That like this is a very small task. There are certain things I want to teach because everything is so very dependent upon how you read. आप कैसे पढ़ते हो? The way you read is very important. You are an emergency and nurse. A man has presented. So I'm sorry, I'm distracting you a little, but I'm telling you why my English or my speaking is good just because I know about grammar. Grammar is the first thing that gives you confidence. So man has presented. So that is an active voice. Man has presented. It is a present perfect tense. Yani man apne aap aaya. It is an active form. A man has presented at your accident and emergency department at 3 a.m. His states, he states. जैसे हम कहते हैं he requires. He के साथ SES. हर चीज में आपकी लर्निंग है. एवरी सिंगल सेंटेंस इज अ लर्निंग. बस आप जल्दी में होते हो, आपको ये चीजें दिखती नहीं है. That is what I want you to see in reading. That is what I want you to see in writing. That is what I want you to see in speaking as well. You can learn so many things. So please try to devote more time to English and sentences. So a man has presented means present perfect. He has presented. He states that his name is Joseph Groom. He has suffered. Again same tense. उसने सफर किया है. Present perfect. He has suffered a head injury and may have mild concussion. So that is a probability. He also has cuts and bruises to his body. His right hand is swollen and his clothes are torn. So this is a passive voice, is MR third form. That means we want to say passive voice has been found to be swollen. His clothes are torn means by someone. जहाँ जिससे भी वो लड़ा होगा तो clothes को हमेशा पैसिव में बनाते हैं क्योंकि ये नॉन लिविंग थिंग होती है clothes. So his clothes are torn by someone. He is intoxicated. यहाँ पे ये ड्रंक की तरह काम कर रहा है. He insists he wants something for the pain relief. So the topic is very simple, but in actually final paper exam, this topic is something that can really take lot of effort. Just because examiner will keep on saying, I need pain relief, I need pain relief, and you would have to repeat your sentences. So that is where you need expertise. So you will have only 3 minutes to prepare and have 5 minutes to speak. In this task, which is so small, 5 minutes can be really hard to cover. So that is where you need mastery or command over your language. So please try to learn the maximum. Ask for the details what happened. Ask for the details what happened. Find out the extent of his injuries. So ask for the details what happened. So first of all, you need to ask. So this will consume some time because patient will explain you this and this happened. And then find out the extent of injuries. So this point is something that gives you time. So you say, okay, don't worry, let me examine you. After examination, I have found that you may have mild concussion, you have cuts and bruises on your body, and also your right hand is swollen and your clothes are torn, and you seem to be intoxicated as well. So I need to ask you, are you drunk? Okay, so these are the points which covers time. On examination, I have found. I will again explain you this thing. So, but again, try to speak it with me. अगर आप सीखना चाहते हो तो मेरे साथ साथ बोलो. Explain that you cannot administer pain relief before examination by the doctor. तो आप obviously कहोगे, please understand, you need to wait for a doctor. Or nurse, I can't wait for a doctor. I am having pain. Please give me medication. See, I am understanding your point, and I understand that you are having pain, and for that pain relieving medication is important. But being a nurse, I am not allowed to give you pain relieving medications. It's only after the examination by the doctor you can get the pain relieving medications. Nurse, what is wrong with you? It's simple painkillers. You are a nurse. Why can't you give me medication? Please calm down and try to understand that I am not the authorized person. Being a nurse, I am not, as per the medical protocol, I am not allowed to prescribe you medications. Only doctor can prescribe you medications, and that can happen only after the thorough assessment. So please try and understand, you need to wait for the doctor. But nurse, I need the pain relieving, I want to go home. See, try to understand. As I have just confirmed that you are drunk, so I would like to tell you that all the medications have side effects, and in some cases these side effects are exacerbated by alcohol. So that is the major reason, that because you are drunk, I can't give you simple painkillers, because this simple painkiller may have some adverse effects that can even deteriorate your condition. So rather than improving, you might have deterioration of your condition. That is why I am stopping you. Please try and understand, you need to wait for the doctor. So that is what is the role play of your. Now I will speak it formally and will try to maintain the tone as well. तो इस लाइन के बाद जो जो मैं बोलूंगा मेरे पीछे पीछे बोलना, जो अभी तक मैंने वट एवर आई हैव स्पोकन अंटिल नाउ उसे लिखना, प्लीज लिखना। और एक्चुअल में आप टास्क कैसे करोगे, ऐसे। और टाइम मेरा शुरू हो रहा है 11 मिनट्स अब। ठीक है, 11 मिनट्स पे मेरी वॉच है अभी, तो मुझे 16 तक बोलना है। गुड मॉर्निंग, माई नेम इज BKM and I am your nurse. I am a nurse over here, so how may I help you? Well, nurse, see, I'm here. I need painkiller medications. Okay, please have a seat. First of all, before giving you any painkiller medications, I need to know what has happened. So could you please tell me what has happened with you? Well, nurse, I don't know. I was drinking with my friends and we were having a very good time. I don't know how did it happen. We got into a duel. We had a fight, and somebody blew me, and then I fell down. And after that, I do not remember anything. So I've come here. I just need pain relieving medications. I would go home and sleep. Okay. So as you have told me that you were drinking at that point of time, so I would like to tell you, first of all, I need to examine you. I need to assess you the extent of injury you are having at the moment. So could you please allow me to assess you? Well, yes, nurse, you can. Okay, thank you for giving me the permission. So I would like to tell you that you might have mild concussion as you have suffered from a head injury. Also, you have cuts and bruises on your body. Your right hand is swollen and your clothes are torn. And also, you have drunk as well, which you have already told me. Am I right? Well, yes, nurse, I'm telling you, my hand is swollen. I'm having so much of pain. I had a fight. I've already explained you everything. Why are you wasting my time? Why don't you just give me painkillers and let me go? First of all, please calm down and relax. I am here to help you only. I'm really sorry to say that I cannot administer you any pain relieving medications or can't prescribe any pain relieving medication because I am a nurse. I'm not the authorized person as per the medical protocol. So I'm really sorry to say I can't give you any medication. But nurse, it's just simple painkiller. Then what should I do? See, I understand it's a simple painkiller. That is why you need to wait for the doctor. I have already informed the doctor. He is on his way. So he will come soon and he will prescribe you medication. So there is nothing to worry. He is on his way, as I have just told you. But nurse, why don't you understand? I need to go home and sleep. See, I would like to tell you that these medications, all kind of medications, have some kind of adverse effect. So especially when you are having alcohol. So that is what I would like to tell you, that these medications can have some serious side effects. Rather than improving your condition, it can rather deteriorate your condition. So please relax and calm down and wait for a while. It's just matter of like just 2-3 minutes. Doctor is on his way. He will come straight away and he will examine you, and straight away he will give you the medications. But nurse, I don't want to wait here. Why don't you understand? I totally understand. That is why I am here with you. Don't worry. I'm here to provide you the best services. By the time I am assessing your wounds, and the doctor will come soon and he will prescribe you pain relieving medications. Well, nurse, you are not understanding my point and you're wasting my time. I don't know. I think you are not a nurse even. वो कुछ भी बोल सकते हैं. Then you have to say, see, I totally understand that at this moment you are having pain. So obviously what you are speaking is right, but at the same time you need to have some patience, because it is only by the doctor that he can give you the medication. So you need to wait. Okay, nurse. Well, okay, then I will wait for the doctor. I don't care. So, okay, by that time you have a seat and you have a glass of water. Please have this glass of water, and I am standing next to you. If you need anything, do let me know. Also, there is a buzzer beside you. If I would leave from here for like couple of minutes to see other patients, this buzzer is with you only. ये मैं सिर्फ time cover करने की कह रहा हूँ. Otherwise, you won't require things like that. सो ऐसा टास्क लगभग 3.5 to 4 minutes में अगर आप पूरा करते हो तो बिल्कुल परफेक्ट है. सो बिकॉज इसमें आप लीफलेट नहीं दे सकते, इसमें आप रीएश्योर नहीं कर सकते. हाँ, रीएश्योर इन अ वे कर सकते हो दैट देयर इज नथिंग टू वरी, बट वो भी आप नहीं कर सकते बिकॉज डॉक्टर विल कम, ही विल एग्जामिन, ही माइट से दैट पेशेंट नीड्स एक्सरे. तो यहाँ पे आप कुछ कर नहीं सकते. लेकिन अगर पेपर में टास्क आता है, यू विल हैव इनफ डाटा, सो यू डोंट हैव टू वरी अबाउट एनीथिंग. So these are just kind of tasks created by institutes, and sometimes these tasks are really not up to the mark. लेकिन अगर ये पेपर में आता, आपको काफी कुछ दिया होता है यहाँ पे, so that is what is the point. So अगर आप 3.5 से 4 मिनट ऐसे टास्क में कवर करते हो, you're all good. So that is how you go. जैसे अब मैंने भी कोशिश की बट मैं कवर नहीं कर पाया. टोटल आई कुड कवर वाज 4 मिनट ओनली. सो इतना ही कवर हो पाया मेरे से, इससे ज्यादा मुझसे भी नहीं हो पाया. सो देर इज नथिंग टू वरी. अगर आप 4 मिनट, मेन बात है टोन मेंटेन करना और फ्लुएंसी. सो एक बार आप सबके लिए दोबारा, और प्लीज आप सुन तो रहे हो, अभी एक बार और सुन लो थोड़ा और फ्लुएंटली. गुड मॉर्निंग, माय नेम इज बीकेम, आई एम अ नर्स ओवर हियर. सो हाउ मे आई हेल्प यू? वेल नर्स, see, I am here because I was sitting with my friends, I was having drinks, I don't know what happened, we got into a fight, this and that, this and that. He will explain you. Okay, first of all, calm down and relax and have a seat. First of all, let me examine your wounds. Okay, after the examination, I have found that you have suffered a head injury and you may have mild concussion. So it is very important that doctor should come and examine you. Also, I can see that there are cuts and bruises on your body. So I will dress those wounds. And also your hand is swollen and your clothes are torn. So please relax for a while, and doctor is coming soon. He will attend you shortly. And I have already informed the doctor. But nurse, I just need a painkiller, I want to go home. See, at this moment it is not good for you to go home because you are having many cuts and bruises, you have mild concussion as well. So basically you have a head injury. So in these cases it is very important to be examined by doctor. So please wait for a while before you leave. So it is very important for you to wait for the doctor, and doctor will do examination. Nurse, but okay, I will wait for the doctor, can you give me medication? I am sorry, as per the medical protocol, being a nurse, I am not an authorized person to give you medications. So please calm down and relax. As I have just mentioned that I have already informed the doctor. Is on his way. He will come soon. Okay, nurse, that's fine. And then you say, why can't you give me medication? Nurse, it's just simple painkiller. I understand it's a simple painkiller, but as you have told me that you were drinking, so there are all medications which have side effects, and in some cases these are exacerbated by the alcohol. So now you are under the influence of alcohol, so it can have some serious complications. So please try and understand, these medications will not improve your conditions, rather it can lead to deterioration of your condition. So please calm down and relax. Okay nurse, this and that. And now please let me check your vitals. Let me assess your vitals, and at the same time, by the time I will dress your cuts, and and in the meanwhile doctor will come, so don't worry. And also I'm standing next to you, by the time doctor comes. Is it all right? Okay. And also there is a buzzer. If you need anything, you can press the buzzer as well, if I have to see any other patient. But I'm standing next to you for the meanwhile, so you don't have to worry about the buzzer as well. तो मतलब वैसे बजर है आपके पास, बजाना है तो बजा लेना, अगर मैं कहीं पे गई तो, अगर इमरजेंसी में जाना पड़ा, वैसे मैं कहीं जानी थी, अदरवाइज आई एम स्टैंडिंग हेयर ओनली. सो व्हाट आई मीन बाय दिस स्टेटमेंट, मैं ऐसी लाइंस को इसलिए क्रिएट कर पाता हूँ बिकॉज अगेन आई हैव कंप्लीट कमांड ओवर माई लैंग्वेज. सो मतलब मुझे टास्क खींचना है तो मैं खींच पाता हूँ. सो अल्टीमेटली जब आप कहते हो कि टास्क को कैसे खींचना है, सो इट इज मोर ऑफ अ स्किल ऑफ योर स्पीकिंग ओनली. सो इट्स डेवलपमेंट ऑफ दैट स्पीकिंग फ्लुएंसी दैट इज नीडेड. सो प्लीज ट्राई टू लिसन टू दिस स्टार्ट 2-3 टाइम्स. कुछ ना कुछ आपके माइंड में जरूर समथिंग विल स्टिक इन योर माइंड. अगर आप 3 बार सुनते हो, 4 बार सुनते हो, इफ यू लिसन टू इट 3-4 टाइम्स, समथिंग गेट्स इनटू योर सबकॉन्शियस, अपने आप चला जाता है. लेकिन इफ यू लिसन टू इट ओनली 1 टाइम, यू लर्न नथिंग, यू लर्न एब्सोल्युटली नथिंग. तभी अब देखो, मैंने 3 बार बोला, आई स्पोक 3 टाइम्स, और इसमें कोई मेहनत भी नहीं लग रही. आपको लग रहा है इट्स जस्ट लुकिंग लाइक वी आर वर्किंग हार्ड. इट्स नॉट हार्ड वर्क, वैसे भी तो बातें कर रहे हैं, वैसे अदरवाइज ऑल्सो वी आर हैविंग गॉसिप्स. So what's the big deal? So please do your work. Speak it 3 times, 4 times. It will not take even 20 minutes to speak it 5 times. So please keep on practicing. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. Thank you.